greatest investment of our lives is health. So join me, Gladys Mumbua, every Saturday at 2:30 p.m. on Doctor's Call, where we get tips and knowledge on how to expand this vast investment. Good afternoon, viewers. Welcome to another episode of Doctor's Call with me, Gladys Boit. And on today's episode, we're going to talk about breastfeeding. What is breastfeeding? And especially to the young moms who are navigating breastfeeding, today this topic is for you. Remember, you can contact us on our social media platforms, Riverside TV KE, Facebook and Instagram, Riverside TV Kenya, YouTube. You can also contact us on 0707 126 050. Today we have a lovely guest in studio. I'll allow her to introduce herself. Welcome.
Thank you. Good afternoon. So I'm Jemima Njagi, a clinical officer, a pediatric by profession, and currently I'm based at Memorial Hospital in Thika. And pediatric is a branch of medicine that deals with children 0 years, that is newborns, up to 15 years or up to adolescents 18 years. Yes.
Okay. You've said today we are talking about breastfeeding, and I'm sure there's a lot of moms out there. Yes, they understand it, but most do not know the right ways or anything to do with it. So I'd like to ask, what are the contents of breastfeeding?
Okay. Breast milk, first of all, is the standard milk for every kid. That is why we recommend to have exclusive breastfeeding. When we say exclusive, it is breast milk and breast milk alone. So the contents, number one that comes out first is water, which is 90%. So water is the one that comes out. Then we have other things like vitamins, we have proteins, we have carbohydrates where now these babies get energy from. We also have minerals, we have lipids that help in brain development and most things. That is why we recommend, if you're breastfeeding, you don't do 5 minutes from one breast to the other, because what comes out first is water. So that baby will not benefit from the content.
Immediately you give birth, or?
Yes, breastfeeding should be initiated immediately. Okay. If it's a normal delivery, you should put that baby to the breast within 30 minutes of delivery. If it's a CS, which is a cesarean section, at least we give 1 hour.
Okay.
Yeah, it should be immediately.
Okay, it is important to note that you've mentioned 90% is water, because most feel like other than breast milk, they can alternate it with actual water.
No.
Okay.
Yes.
So, when you start breastfeeding, how do you know that your baby is getting enough milk?
Ways of knowing if the baby is getting enough milk, first of all, is weight gain. We expect this baby to gain weight every month. That is why we encourage mothers. You go for those clinics because we need to know how the weight is. If the weight is below every time, then we know there is an issue when it comes to breastfeeding. Other things, the number of diaper changes. Now the wetting. So you ask the mom how many times they are changing the diapers. So it should be 8 to 10 times in 24 hours.
Okay.
Yes. So those are some of the ways to know that this baby is getting enough milk.
Okay.
Yes.
Also, what are some of the benefits of breastfeeding?
Benefits of breastfeeding, we have mentioned about weight gain.
Yeah.
So that is number one. Other things we know is the breast milk nourishes this baby. And also it creates a good bond between the mother and the child. When you're holding the baby, that bond is very, very strong. So we encourage it. And also most bacterial infections, we have, like we said, in the contents of the breast milk, we have things like the minerals, the immune factors. Those prevent the babies from getting infected easily. So that is why the breast milk is important.
Okay.
Yes.
Also, are there techniques of breastfeeding, or is it just the same for everyone?
No, it's not. It is good you have asked that because it's very important, especially to the upcoming mothers. Now, when you're breastfeeding, we have techniques. First of all, we encourage the mother to wash their hands because it should be they should not be contaminated. It should be a clean process.
Okay.
So then you hold the baby well. We have two ways. We have a good positioning to the breast. We have good attachment to the breast. So we can start one by one. What the good positioning, we start with that. How to hold, to position the baby. The chin is this part of the body.
Yeah.
So the chin should touch the breast when the baby is breastfeeding. And then the head and the whole body should be in the straight line. You should, like, the baby should be like this.
Yeah.
Like this. Yeah, on a straight line. And then this baby also is supposed, the head should not be tilted up. So those are some of the positioning.
Okay.
Then attachment, you are attaching the baby. How do you know that the baby is well attached? You start by the lower lip. This is the lip. So it should be rolled outward. That's a good attachment. Now you are able to say this baby is well attached to the breast. Other ways, we have like the black part of the breast. We call it areola. The areola, the most part of it should remain upward and not downward. When you find it is remaining, most of it is downward, you know, this is not the best attachment.
Okay.
So those are some of the attachment, and very important, because if you don't do this, the baby doesn't breastfeed anything. They're not comfortable. So that's why we have to ensure this.
So the baby's mouth should not cover the entire areola.
The whole, you don't give just the nipple. We give the whole black part. If it's remaining, most of it should remain upward, not downward. That is what I meant.
Okay.
Yes, because if you give just the nipple, we are going to have issues, because this is just the nipple the baby is sipping, and they are going to crack. Very uncomfortable to the mother. Also, the baby does not get anything. It's through the areola that now the milk comes out. Yes.
Okay, you've had that positioning takes a great place in how you're breastfeeding your child. So, are there factors that probably could affect the mother's secretion of milk?
Yes, there are factors. One of it is stress. If the mom is stressed up, automatically the milk is going to be cut down. There is not going to be enough milk. So we have drugs. We have some drugs that if the mom is under any medication, so we should be very keen. You ask them to ask their doctors about the drugs they are using. Tell them that they are breastfeeding, so that there are drugs that we say are contraindicated. You should not use them. You should not use them when breastfeeding. So those are some of the things.
Well, viewers, you've heard about the best positioning methods while breastfeeding your child. So someone would ask, is it really a must for me to breastfeed my child for 6 months? So what are some of the benefits of actually breastfeeding your child?
Okay, the benefits, we have many, like one, breastfeeding promotes bonding between the mother and the baby. Also, it nourishes the body of this child. Then another thing, breastfeeding is cheap. It is very cheap. You don't have to go to buy milk, so it is very cheap. It is safe. When I mean, being the safety means that it is not contaminated. It is sterile. That is the word we use, sterile.
Okay.
Breastfeeding again, it brings about the gastric emptying is easier. Like when this baby is passing stool or urine, it is very, very easy. We don't have like constipation. The baby is not able to pass well. So the gastric emptying, this is what it means. It prevents breast engorgement. Now this is to the mother.
Okay.
The engorgement is that the breast seems to be full now, and so this milk is not remaining in the breast. So this is a breast engorgement.
Yeah.
So it helps. It also helps. It is affordable. Breastfeeding is affordable and accessible at the same time. That is why it should be started immediately.
Okay.
Yeah, after the baby is born.
Okay.
Yes.
So someone is asking, we've talked about diaper changes.
Yes.
Someone is saying they exclusively breast their baby, but then the baby does not pass stool as frequently. Is that normal? Is that okay?
Urine.
No, stool.
The stool.
Yeah.
It is very normal. Actually, you see mothers coming to hospital,
Mhm.
running. The kids are not passing stool, but we give up to 5 days. Imagine.
5
If the baby
days.
doesn't pass stool, the first day it's still okay. Second, third, fourth. Now what rings the bell now? The alarm is now after the fifth day, and the baby is able to breastfeed. So we know there's something happening, maybe indigestion or something. But if you find again the abdomen is not distended, then we still are okay. But we keep following up with that baby.
Oh, so it's okay for up to 5 days?
Yes, very
Okay.
much okay.
So there's no need to panic?
No need to panic.
Okay.
Yes.
Also, another one is asking, what about mothers that are going back to work? Now, this mother needs to go back to work.
Yes.
Like, what happens? How much milk should they pump? The storage? How should they store the milk?
Yes, a very important question. You see, the mothers definitely have to work. So when the mom goes back to work, the breastfeeding continues. This is how we do it. So the mom is advised to express the breast milk. Now, it will depend with the amount that is coming out this mother is able to get. So this milk should be stored in the fridge, at the freezer, and it can stay there as long as it is in the freezer. It can stay there for even up to even 8 hours. It's still very okay. So we even advise, immediately after giving birth, there's the first milk that comes out. We call it the colostrum. Very, very nutritious to these kids. So we advise them, if you have a lot, just express it, put it in the fridge. You can put it in the fridge. That one doesn't even go bad so fast. You can keep it there for 4 months in the freezer. So when you come back now, the baby is now 3 months. Now you're going back to work. You can go back to this colostrum that you stored 4 months ago, as long as it is in the freezer.
Okay, someone will ask, I've stored the milk. Should I boil it? What are the methods?
No, yes, a good question. You see now this milk is in the freezer. Now you cannot remove it and give it direct to this kid because it's cold. So what you do, you don't like use sufurias or things to boil it. What you do, you get some hot water, you put it inside in another container, then you dip. For a few minutes, this milk is warm and it is safe for this kid.
Okay.
Yes.
Well, viewers, we are going for a very short commercial break. We'll be right back after the break.
Are you looking for a place you can preach live on TV? We are now live. Yes, now we can cast your event live on Riverside TV just for 3,000 bob. Yes, 3,000 bob for 30 minutes. See flyers and posters for more info or call 0707 126 050. Riverside TV, inspiring and refreshing.
Welcome back, viewer. I hope you're following our conversation. Remember, if you have any question, you can ask us through our social media platforms, Facebook and Instagram, Riverside TV KE. You can also send us a message on our number on your screen below, 0707 126 050. If you're just joining us now, we are talking about breastfeeding and all the good things about breastfeeding. So there's something known as the AFAS criteria when breastfeeding.
Yes.
Now, when we say AFAS, what do we mean? What is AFAS?
So now AFAS for AFASS. So when we start saying AFAS, it's to those moms who are not able to breastfeed. Maybe they have some kind of illnesses, so they're not able to breastfeed. So that procedure, the way that they want to use other than the breast milk, should be AFAS.
Okay.
So the first AFAS, it should be acceptable, whatever method they want. If it's none, it's the best and it's acceptable for this child. So F, it's for feasible. The method should be feasible, meaning they should have the knowledge and the time with this, whatever they are using. They have the knowledge about what they are using on this kid. The method should be affordable. They should not strain. It should be cost friendly, pocket friendly. So this is the sustainability. The affordability. The first S for sustainable. The method should be sustainable. It should be continuous, not like they'll get it today and then tomorrow they are not able to get. So this is what you mean by sustainable. The method should be safe. Safe in terms of good hygiene. It is not contaminated. no risk to this baby.
Okay.
So the AFAS is for those mothers, the alternative to breastfeeding. If there is that alternative, it should be AFAS. It should be acceptable, it should be feasible, it should be affordable, it should be sustainable, and it should be also be safe.
Also, now that we've talked about AFAS, what are some of these methods?
Like use of none, you say none, anything other than the breast milk.
Okay.
Yes.
Is it only none, or is there another option that you can use?
No, okay, mostly it's none, only that we have different, when it comes to none,
Different
they are different, yes, they're
Okay.
different, but still none.
Okay,
Yes.
okay. So, what are some of the factors that could affect breast milk secretion?
One factor is stress.
Mhm.
If this mom is stressed up, the milk will cut down.
Mhm.
So we advise the mom to relax and breastfeed. No, not to involve themselves. Okay, you are a human being. You might
Yeah.
be having things that are disturbing, but we try to make them relax while breastfeeding. We train them that stress will really bring this milk down. So that's why we say stress is number one. We also have diet. So these mothers should be getting a good diet, and good diet is things like the balanced diet.
Yeah.
This meal should have carbohydrates, should have vitamins, should have proteins. Also, they should drink water.
Yeah.
It is very good for this kid. Other things, drugs. We have drugs that are not supposed to be used when the mom is breastfeeding. So we advise them, if they have to use those drugs while breastfeeding, they should contact their doctors first so that they can advise them accordingly. Yeah, those are some of the factors that will make this milk go down.
Now, in the case of drugs, let's say if it's unavoidable and I have to take this medication, let's say for like 2 or 3 days, now what happens to the baby during that time? If for instance, the drugs we are talking about that they should not take while breastfeeding, if, for instance, you have to take it while breastfeeding, so what is the next course of action? Do you express before beginning the medication?
It's also a way of expressing before you begin. Because now, when immediately, you see what happens, whatever this mom feeds on, either drugs, food, is what this baby gets through breastfeeding.
Yeah.
Especially those young kids that are on exclusive breast milk. We've not started giving mixed food, other food after 6 months. So this baby is on just breast milk. So we can have options when it comes also to drugs. We have drugs that we can maybe use this instead of
Other
this.
than this,
Yeah.
okay.
Mm.
Also, there are moms who, and this is not to be judged, but probably a mother who likes a glass of wine or two. Does that affect the breast milk? And you know, they say if you drink, pia huyo mtoto atakuwa mlevi.
Yes.
Is it true?
It is very true.
Okay.
So we discourage alcohol intake because this baby, like we said, will get everything, even that alcohol. So after birth, this baby is affected mentally and you're not able to see. Why? Because you were taking this alcohol either while pregnant or even while now breastfeeding.
Okay.
Yeah.
Are there consequences of not breastfeeding? Now that we've talked about why it is important to breastfeed, what are the consequences if one chooses not to?
Yeah, the consequences are there and they are to both the mother
and the baby.
kid. So first we are going to talk about the consequences to the mother. This we call maternal problems. So one is breast engorgement. You imagine the breast is coming out but the mother is not breastfeeding. So it engorges, the breast becomes, it is hard. It is hard and it's not able to come out because you're not giving this baby. And it's not even safe for this child when you don't breastfeed for some time. So when the breasts are engorged. Also, we have sore nipples, the cracking of the nipples. And the mothers who are seeing this, those who have experienced this, I know it's not the best experience. Cracked nipples, very, very painful. So you have again to go to hospital first of all and get treated. So cracked nipples. We have infections like mastitis. Mastitis is infection of the breast. So you have again to go to hospital and get treated. And we don't want mothers to take those drugs while breastfeeding. You see, you can avoid it just by breastfeeding the best way. We also have breast abscesses. The whole breast is covered with pus. this is the accumulation of pus.
Mm-hmm.
So you find they even go to hospital. There's something called IND, incision and drainage.
Mm-hmm.
We cut this breast, we drain this pus. It's again expensive. It is even costly.
Painful.
All those, and we can avoid. So
Yeah.
these are some of the maternal problems.
Mm-hmm.
Now, when we come to the kid, now we call them neonatal problems.
Mm-hmm.
A neonate is this newborn.
Yeah.
A neonate normally we define as a kid who is 0 years to 30 days. These small kids.
Yeah.
So these ones, they'll get first thing dehydration.
Mm-hmm.
If the child does not breastfeed, they are going to get dehydration.
Okay.
So like dehydration, they don't have enough. Their skin is going to be, we normally check the dehydration by pinching the abdomen of this kid.
Mm-hmm.
So when you pinch, it goes back so slowly. So this tells you the skin is not well hydrated. You have dehydration.
Mm-hmm.
Even when you check in the eyes, you find they're so dry. Also, you are able to say that this child is not getting enough. You are not breastfeeding well, and we have dehydration here.
Okay.
So we start again admitting the kid, you see. We treat for this dehydration. So it comes with a lot of consequences. So
Yeah.
dehydration is number one. We also have jaundice. Jaundice is the yellowness of the eyes.
Yeah.
So this yellowness is because of not breastfeeding. So you find the mother gives birth, they go home, they come back to hospital saying that the kid has got yellowness of the eyes. So what you tell them that you're supposed to go back and to do things. Breastfeed the kid well, also expose this child to the
sunlight.
Yes. So these are because the reason why we are doing this jaundice, we have things that were not well metabolized called bilirubin. So those ones are the ones that remained on the skin. So we try to break them down further by exposing to the light and
Yeah.
also by breastfeeding. So
Okay.
jaundice, it's called neonatal jaundice. It's another problem. So we also have failure to thrive. Failure to thrive is failure to gain weight. So this baby will just be underweight every time because they didn't get enough milk.
Okay.
So those are some of the consequences to the child.
Okay, we've talked about consequences of not breastfeeding enough. Is there something as excessive breastfeeding where this mother over breastfeeds?
No, there's nothing like that.
Mm-hmm.
We said I should tell mothers, you should breastfeed this kid anytime, anywhere. The child is breastfed on demand. If they cry in the matatu, they should breastfeed. If you are somewhere in a function, take your time and breastfeed. So what you should ensure is the hygiene. So we tell them before you even breastfeed, you wash your hands every time because you don't want to transfer these infections.
Yeah.
You hold the baby, the breast, you have not washed your hands. So breastfeeding is on demand. There's nothing like over.
So it's as frequent as possible.
As frequent as possible, and this is what we advise.
Okay, so someone is asking, what happens when I get pregnant and I'm still breastfeeding? What happens? Do I stop breastfeeding?
So this one now you work closely with if it's your gyna, because there's that time that reaches whereby it becomes impossible because now the pregnancy also, we have some body needs when you're pregnant. This baby who was breastfeeding still needs something from your body, so it becomes a bit difficult to balance, and your gyna will recommend you to at a point to stop for the sake of this one now who is growing inside the womb.
Yeah. Okay.
Good thing to do. First of all, like you've heard the benefits, like the bond. You become too close to your child when you're breastfeeding every time. So just do it. Do the best positionings, like we have said, the attachment, good hygiene. We contaminate this milk while if you're not washing your hands. Wash your hands every time you're breastfeeding. Feel good when you're doing it to your child. Know this is the best diet for this kid. Normally we say exclusive breastfeeding for 6 months. Exclusive we mean there's no water. Even water is other food. So it will be mixed food if you even add water. So don't give anything, like we said, breast milk has got 90% of water. So this is where this child will quench their thirst from. Don't take any water. Don't give extra water. Just breastfeed for the 6 months. And again, we recommend to do it up to 2 years or even beyond. So it's still very okay. Thank you.
Maybe before you just sign out, we have seen in a scenario where the mother has died, Kobati mbaya, and then the grandmother takes on kunyonyesha na kila kitu.
So you can look for other ways as long as it's
affordable, acceptable.
The AFAS I was talking about. The AFAS was if you're using an alternative because of such cases. See, that one you can't atuezi zuia. It may happen, the mom has died and it happens. So it should be AFAS. As long as it is AFAS, yes. Yeah.
Well, viewers, you have heard it here. Breastfeeding is important and you've heard everything about it. Remember, you can follow this conversation on our social media platforms. You can also watch this video on our YouTube page, Riverside TV Kenya. Until next time, I have been your host, Gladys Boyd.